All right.
It's all
Thank you for
yours.
the warm introduction. I appreciate it. Always a pleasure to be back with Arlington Neighborhood Village. We do have a robust session, so I'm going to go ahead and dive into the presentation. So I'll present first, and then I'll pass the baton over to Olivia. But today's presentation, I'm going to talk about Medicare open enrollment. The slides are current as of the end of last month. And always want to put a caveat in because Medicare policy is always subject to change. The Virginia Insurance Counseling and Assistance Program is the program that I run here in Arlington County. It's a part of the SHIP network, State Health Insurance and Assistance Program, which has offices across the United States of America to include DC, Puerto Rico, Guam, and the U.S. Virgin Islands. In all programs, it is staffed by paid employees like myself and then a group of volunteers. And together, we provide free, unbiased, confidential counseling to residents in our respective jurisdictions. So here in Arlington County, for the VICAP program, we counsel Arlington County residents. I think there are some folks that are joining us here today that are not Arlington residents. It's okay. So glad you're here. If you want the office in your respective jurisdiction, please send me an email at medicarehelp@arlingtonva.us and we can set up a time to talk. But our team
Michelle,
helps to,
before you
yes,
go on, I'm seeing your slide and the next slide as opposed to just a slideshow
I'll
that
just,
shows a single slide.
okay. Um, let's see if I do it this way, if that'll, nope.
Nope, now we're seeing all the slides.
Okay, let's leave it like this, Greg. I think that's
Okay.
something we could have addressed beforehand, but I don't want to take up too much time toggling here. But our team helps to provide counseling around Medicare, all facets of Medicare, Medigap policies, the Medicare Savings Program, long-term care, and other types of health insurance. We also help people to file appeals, and a lot of the work that we do consists around advocacy. So, helping people advocate for their rights on the health and prescription drug side. Today, I'm going to talk about Medicare coverage, the enrollment periods, questions people need to consider. Medicare open enrollment is a little bit more than a month away. It starts October 15th. I will share some highlights into what I've seen that's new for 2026, which will be a great segue for then to tag Olivia. And then, of course, wrap up with how you can contact our office for assistance. So Medicare is health insurance provided to individuals that are 65 years of age and older, or individuals under 65 with disability. There are also opportunities for people to enroll in Medicare if they have end-stage renal disease or Lou Gehrig's disease. While Medicare is administered by our federal partner, CMS, the Centers for Medicare and Medicaid Services, Social Security Administration, also known as SSA, is the first point of contact for most enrollments. There are four parts of Medicare. It's Part A is the hospital insurance, B is the medical insurance, C I like to think of as bundled, and then there's Part D for prescription drug coverage. So there are two ways for people to enroll in Medicare. It's original Medicare or Medicare Advantage, not both. When you have original Medicare, you can enroll in a Part D plan. We do suggest people enroll in a Part D plan unless they have what's called creditable coverage. So if you have coverage through your spouse, if you have coverage through your prior employer, those types of instances would be deemed as creditable coverage. When you have original Medicare, you do have the opportunity to enroll in what's called Medigap policy. But on the flip side, if you have a Medicare Advantage plan, it is against the law to be sold a Medigap policy. The difference, one of the stark differences between original Medicare and Medicare Advantage is that there are extra benefits or added benefits. It just all depends. All the plans are different and they change every year. A lot of times people ask us, what's better? What should I choose? Well, we can't offer guidance, specific guidance on which plan you should choose. We do, however, give an overview and the pros and cons of both. And a lot of it really depends on your personal decision. I know for 2025, because CMS has not yet released and updated the Medicare Plan Finder for 2026, the numbers are not yet out. But every year, I'm sorry, for the past few years, we have seen a decrease in the number of Part D prescription drug plans that are available for people to purchase. So not only has there been a decrease in Part D plans, but the cost of those plans are increasing. While on the Medicare Advantage side of the house, the contracts with MA plans continues to increase, sometimes doubling, lowering the cost of those plans. So we always ask people, do you travel often? Are you looking for additional things that original Medicare does not cover? Um, do your doctors cover Medicare Advantage plan? So once we start walking people through that list, then it helps to give them a clear understanding of what can be considered. So, what is Medicare's prescription drug coverage? I'm glad you asked. We're going to talk about that a little bit. There are one of two ways people can get Medicare prescription drug coverage. They can get it by adding it to a original Medicare plan or through by adding it to a Medicare Advantage plan. For those who like to peruse through Medicare.gov's website on the plan finder, while there are Medicare Advantage plans there, all of them do not have prescription drug coverage connected to it. So again, we do encourage people to enroll in those plans when they don't have creditable coverage, because if you don't, you'll be faced with a lifetime penalty. So when it comes to joining a plan, there are some prerequisites that need to happen. So to join a Medicare drug plan, you must have Part A or Medicare Part B. You must be a U.S. citizen or lawfully present in the U.S. And then you must live in the service area of the plan you want to join. The service area is merely the zip code. So if you live in Arlington County and you're looking for a plan in Oklahoma, that wouldn't be the best next step, right? So you need to find a plan, and we help people find plans in the jurisdiction in which they reside. On the other hand, to join a Medicare Advantage plan with drug coverage, you must have Part A and Part B to enroll in Part C. So Medicare Advantage and Part C are synonymous. If you think about it like that, you have to have A and B to join C. That's an easy way to consider that. And the same rules apply. You still need to be a U.S. citizen or lawfully present in the U.S. and then choose a plan in the service area that you want to join. What does Medicare prescription coverage cost and what might lower or raise costs? So glad you asked. So Medicare prescription costs change every year. It varies by plan. Of course, people with a higher income pay more. This year, the annual deductible is $590. It is projected to rise to $615 next year. Co-insurances and co-pays also vary by plan. What I'd like to point out that's the same, it has not yet changed based on any federal changes just yet, is the cost of insulin. So for those who know, January in 2025, there was information that came out through the Inflation Reduction Act that talked about insulin, the reduced cost of insulin being $35. But what I want to caveat to tell people is that this is not applicable to all insulin drugs. It's just some. So our team can help you figure out if your insulin coverage is one of those drugs that have the lower cost. And if not, we do connect people to programs that help lower their out-of-pocket cost. One being the Extra Help program. So the Extra Help program, also known as the Part D Low Income Subsidy, is a federal program sponsored by Social Security Administration. Our team does help people enroll in that plan. And when they are eligible and get approved, it helps to lower the cost of their prescription drug coverage. Um, past years, especially this year, it has saved people up to $5,200 a year. But in 2026, the estimated cost savings for a person enrolled in Extra Help increases to $6,200 a year, which is great. There are income and asset guidelines for the Extra Help program. You're automatically eligible if you have Social Security, SSI, Medicaid, or Medicaid Savings Program, which is a part of Medicaid. There are many other ways that we talk to individuals about how they can lower their drug costs. Sometimes it's a short-term solution bridged with a longer-term solution so people can talk to their doctor about getting generic drugs. Sometimes it works, sometimes it doesn't. We encourage people to ask for samples. That is a temporary solution. You can talk with your doctor about tier exceptions. Patient assistance programs is a longer term solution. For those people who are eligible, we get them connected to a PAP. And once they are eligible and approved, the drug company will cover the drug over the course of 12-month period. So the beneficiary doesn't come out of their pocket for the entire year. And through that resource, we've saved people $5,000 to $10,000 because, as we all know, some medication can be extremely expensive. Do I need to, and when should I enroll in Medicare? We get that question often, so definitely wanted to address it. While SSA often says Part D is optional, it is. However, there are repercussions to not joining a Part D plan or a prescription drug plan. Again, if you don't have creditable coverage, there is a lifetime late enrollment penalty that could be applicable. So we do steer people away from, not enrolling even when they don't have insurance. Creditable coverage could be considered as employee coverage, retiree insurance, TRICARE when folks have military benefits, or federal health benefits as well. There are several enrollment periods. Medicare is like alphabet soup. There's the IEP, or the initial enrollment period. So that happens 3 months before your birthday, the month of your birthday, and then 3 months following your birthday. And there are several opportunities that could trigger what's called a special enrollment period, or SEP. That could be loss of coverage, moving out of the service plan, enrolling in a five-star plan, or losing extra help. And of course, based on the climate, we are seeing more people give us a call around life-changing, situations like losing employment, unfortunately.
Michelle, can you explain what a five-star plan is?
Oh, sure. Let me go back. So the five-star plan is one of the best plans that Medicare offers. Each plan does not offer a five-star plan, but there is a rating system that is on Medicare.gov that people can look at, and all plans are rated at a certain level. So CMS has that information public facing. When you go to Medicare.gov, you find a plan like Humana, for example, and you'll see, it may say 3 stars or 4 stars or 5 stars. A five-star plan is one of the better plans that people can enroll in. Again, looking into the plans in your service area to be able to do that. Sometimes when you enroll in a five-star plan, it can help to reduce the out-of-pocket costs for the payments that a person may be making towards their co-insurance, deductibles, etc. The open enrollment period is coming up very fast. The annual period is every year. It starts between October 15th and it ends December 7th. This is prime time for all SHIP programs to be able to work with the constituents in their area to be able to assess and or change their Medicare coverage. And then immediately following the open enrollment period, we then take a deep dive into the Medicare Advantage enrollment period, which it happens within the first quarter of the year. We do like to tell people, even if they are happy with the plan that they have, they should still do an assessment, either on their own or with one of the SHIP team members to make to be able to make sure they are clear in any upcoming changes that may be outlined in what's called an explanation of benefits or annual notice of change. Those two resources are resources that every Medicare beneficiary receives. They should receive it this month, September, through from the Medicare drug plan that they're enrolled in. It gives you a deep dive and some high level information about what changes are coming down the pike for the plan that you are enrolled in. Why is that important? It's important because sometimes plans change costs $15, $20, $50 in 1 year. And what we find is that when people aren't informed, they don't read the information and they don't reach out to us. Although we ask and have several presentations, they call us in January to say, my plan has increased by 20% or by 50%, and I want to be able to change it now. Well, sometimes it's too late, and they have to wait a whole nother year to be able to do that. I talked about late enrollment penalties. I want to share questions that people can consider asking before I wind it down. When you're thinking about the plans to consider, you can ask, does the plan cover your drugs? That's really the primary question because if you're changing to a plan, which we've seen people do this on their own and then call us to try to fix the situation. They change to a Medicare Advantage plan because they are wowed by the bells and whistles, and then they realize the plan doesn't cover their drugs or the doctor doesn't accept the plan, right? So then that causes a lot of out-of-pocket expenses that the beneficiary has to incur. Are there any restrictions? What are the costs associated with the plan? Of course, considering any benefit programs, extra help, or Medicaid are two out of many. And then, of course, considering whether the pharmacies are preferred in or in network. When it comes to enrolling in a plan, of course, people can always give us a call at 703-228-1725. There's an option to enroll on the Medicare Plan Finder by calling the plan's website. And the last course of action, I would say, would be to call 1-800-Medicare because sometimes they have longer hold times. Let's do a high-level overview of what I found that's new in 2026, and then I'm going to pass the baton over to Olivia. So when it comes to things that are new, of course, higher costs for Medicare, right, is always at the forefront of mind for me and then for the constituents that we serve here in Arlington County. For 2026, the projected Medicare Part B premium is slated to rise to $206 a month. For 2026, the projected Medicare Part D deductible is projected to rise to $615 a year. And then next year, the cap on out-of-pocket prescription drug costs is projected to rise from $2,000 to $2,100. I wanted to highlight the the Medigap birthday rule. I had a brief conversation earlier with someone on the call before we got started about Medigap. So Medigap policies are addition to original Medicare. Again, it's against the law for a broker to sell a person a Medigap policy when they have a Medicare Advantage plan. So when you have original Medicare and you want to enroll in a Medigap plan, our office, our team can give you guidance on how to do that. But then we provide a soft handoff to a broker at the state level. So through the Virginia's Bureau of Insurance, they can help you do that. But there's a new Virginia law that's called the Medigap Birthday Rule that allows a person to enroll in a Medigap policy and change their Medigap policy during their annual 60-day open enrollment period. That just started as of July 1st this year. The Inflation Reduction Act is a wonderful benefit that came down the pike and was signed into law by the Biden administration. I do want to share some highlights of that since it is still intact as of today. There is a limit on the cost sharing for insulin, which I talked about, $35 a month for some insulin drugs. There are free vaccines that are now a permanent feature of Part D plans. So if you need a shingle shot, measles shot, COVID-19, and so many more, it's now free for folks who have Medicare. And then there's the Medicare prescription payment plan, which is an option that allows people to spread their costs over the course of the year. Um, on the CMS.gov website, I did provide the link. So, Greg, at the end of the presentation, I'll send this out so people can take a look at it. The one thing I wanted to highlight about the Medicare prescription payment plan that's going to change for 2026 is that although this program is voluntary, and again, it's aimed at beneficiaries that have higher drug costs. So it doesn't help to alleviate or remove any of the costs. It, in essence, helps people to spread the cost of their payment over time. So it would make sense to enroll in a Medicare prescription payment plan or MPP at the beginning of the year versus the middle, definitely not the end. In 2026, the change is if you opt into the MPP, you'll be automatically renewed for the following year unless you opt out. So takeaways, evaluate your coverage, give us a call if you have any questions, consider programs that help to reduce your out-of-pocket costs. And with that, I will stop sharing my screen and then pass the baton over to Olivia.
Okay, before you do that, Michelle, we do have a few questions. I don't know if you want to address those
Okay,
now.
okay.
First one is, can you explain dual recipient coverage, Medicare plus Medicaid?
Yes, and I can like verbally respond to some of these, Greg, and then I can also respond to some in the chat because I want to make sure Olivia has her full 30 minutes.
Okay.
And then the questions I know that will follow her presentation. So the dual coverage is for Medicare and Medicaid beneficiaries. We do see that often in our program because 30% of the folks that we counsel have Medicaid and have incomes that are 150% below the federal poverty level. So dual dual clients have both. They have both Medicare and then they have both Medicaid. If you want to talk more in depth about it, just please give me a call. I'm happy to discuss that. How can I find out what enrolling in Medicare without Medigap will cost me? Um, I would say closer to October. It's supposed to come out at the end of this month. The Medicare Plan Finder never really gets updated on time. So you will see the 2026 numbers in the Medicare .gov website on the Plan Finder. I would say closer to open enrollment. So checking open enrollment, or you can give us a call after that. The slides will be available. And then let me pass the baton over to Olivia and I'll respond to what I can in the chat.
Thank you, Michelle. Good morning, everyone. My name is Olivia Umoren Ezeuko. I'm the Director of Public Policy and Advocacy at US Aging. US Aging is the National Association of Area Agencies on Aging, and we also support Title VI Native American aging programs. And just to give you a bit of an overview, so US Aging isn't necessarily the organization that you all on this call would go to for, let's say, resources or maybe some additional information, though we do have resources that are available for you to use. But rather, we are basically the organization that supports the organizations that you would go to for support for things like home and community-based services, maybe transportation, meals, things like that. So that would be the Arlington County AAA. There's one in Alexandria as well as Fairfax County. And there are about 25 AAAs in Virginia. 600 plus are across the country. So we are the National Association representing area agencies on aging, also known as AAAs. So very quick overview of our 2025 policy priorities. So a major part of what AAAs do is funded by the Older Americans Act. And we just talked a little bit about Medicare, and something that a lot of people don't know is that the Older Americans Act was basically introduced in the same time as Medicare and Medicaid. We just celebrated, I think it was the 60th anniversary of Older Americans Act this summer. So this is really a key program that provides the necessary funding to serve older adults across the country. Another priority that we have is to really support family and professional caregivers. We know that caregiving is often a full-time job, oftentimes with no compensation. So our priority here is really to support caregivers in that aspect. Another priority is Medicaid home and community-based services, and also connecting the healthcare and aging sectors for improvement in healthcare outcomes. And you are welcome to read our full policy priorities on usaging.org/advocacy. So today I'm going to go over the big beautiful bill, the reconciliation bill, OBA, all of these things. If you hear me say them interchangeably, they're referring to the same thing. And before I get into that, I do want to go over the federal budget because this is quite a complicated bill because there's so many things included in it and because of what exactly it impacts. So very quickly, I just mentioned Older Americans Act. Older Americans Act programs are in this 30% area where you see discretionary. That is discretionary funding, meaning that every single year we have to ask Congress to fund these programs. It's not a given. They usually do, but we still have to do advocacy to make sure that they understand how critical these programs are for older adults across the country. For the reconciliation bill, OBA, One Big Beautiful Beautiful Bill Act, that is the 63% that you see here is mandatory spending. So that's spending that is basically set in stone every year. We do not have to ask Congress to add more money to these programs. That was before all of this, this big beautiful bill happened. So even within the discretionary funding, there's still a smaller percentage of funding that is non-defense discretionary. So this is still for Older Americans Act programs. And I'm showing this so that you all can see really how small the federal funding is for Older Americans Act programs and why it's important to advocate for increased funding for these programs. This is not the same case for Medicare, Medicaid. Their funding is a lot more than Older Americans Act. So quick overview in terms of where we are right now. So we just got into September, and if you all watch the news, you know that around this time is when government shutdown conversations typically happen because we're waiting for Congress to come to a decision and a conclusion in terms of what the funding for the fiscal year 2026 will look like. The Senate already finished their process in July, and they basically had the same level of funding for Older Americans Act programs as they did in the previous year. However, there was a decrease in the Senior Community Service Employment Program. So if any of you have used this program or you're planning to use this program, we still need to wait for Congress to basically negotiate and release a final package. But this is something that was proposed by the Senate. And the House actually just did their markup yesterday. And what this means is each chamber will do their markup, but whatever they come up with doesn't mean that it's final. So whatever they negotiate and the final package that they have that is agreed upon between House and Senate, that is what we're going for or going with for FY 2026 appropriations. And then the next fiscal year will begin on October 1st. But in that September 30th, September 29th period, usually it's a frenzy. You're probably going to start hearing things on the news if Congress doesn't come to an agreement on what they want funding to look like. So just a heads up, because this is also an area of advocacy, if any of you would like to engage with your members of Congress. And I'll be sharing resources on how to do that at the very end of this presentation.
Olivia, can you explain what that senior employment program is?
Yeah, absolutely. So this is a program that basically helps individuals, I believe 55 and older, to find employment and to also find community service or community service opportunities. And I will add that the reason why this particular program is going to be so important is because of some of the Medicaid requirements that we're seeing in the reconciliation bill or One Big Beautiful Bill Act. So I want to also say that just because the Senate proposed a decrease doesn't mean that this program will necessarily have a decrease, but this is going to be a very important program to help individuals 55 and older get the necessary jobs and community service that they need in order to meet the Medicaid requirements from this bill. So here's an example of an advocacy alert. US Aging, we put out advocacy alerts for our members, but also for non-members. So if you are maybe trying to figure out ways to engage, ways to make a difference, ways to make your voice heard, this is a perfect way to do that. And you're able to access this on our website, again, at usaging.org/advocacy alerts. And you'll also see on our website that we have our Older Americans Act 60th campaign. So there you will find things like fact sheets, social media kits, basically everything that you would need to advocate. So you don't have to create anything yourself. We basically have everything that you would need, and all you have to do is just head to the website and you can access those materials for free. So now getting into the nitty gritty, and I'm going to apologize in advance because this is very dense policy information, but I'm going to do my best to explain it in a way that is easy to understand and also in the context of Virginia. So again, I just want to flag that what I'm talking about now is about this 63% mandatory spending from the federal government. So that's the Medicaid, Medicare, SNAP, all of those big programs that people rely on daily. These are the programs that I am talking about now. So, as many of you know, on July 4th, President Trump, he signed into law this bill, and this comes after months and months of turmoil and intense negotiations in Congress, despite loud advocacy from the aging and disability communities. And this bill, it unfortunately lays the foundation for historic cuts to Medicaid and SNAP that will leave many people, including some older adults and people with disabilities, with reduced access to healthcare or food. And really, for us in the Aging Network, we've been focused on the healthcare provisions of this bill, but this is also a bill with many tax provisions that span across things like estate tax, business tax, international tax, as well as major program increases to defense projects and homeland security programs. So I just want to flag that because even though we are focusing on Medicaid and Medicare today, this is truly a very big bill, and there are a lot of components in there. So as I mentioned, this law, it has major implications to Medicaid and SNAP. And with close to $1 trillion in Medicaid cuts projected over the next decade. And the effects of this law, they will not be seen immediately. Most health provisions, they have varying effective and compliance dates that are ranging between 2026 to 2028. And the bill sets the stage for many things, including more expensive health insurance. This bill, it fails to extend enhanced premium tax credits for Affordable Care Act marketplace health plans. And this means that more than 22 million people nationwide will likely face significant premium cost increases next year if they choose to stay on their current plan. For example, a 55-year-old earning about 63,000 per year in Virginia will likely see their annual premium costs increase by at least $2,400 on average. So this is really the state and local level effects of this bill. And Virginia and other states, they are currently working to figure out what this is going to look like. And this is also another way that you can advocate at the state level if you want to do more than advocating with your members of Congress at, excuse me, at the federal level. Also, cuts to Medicaid and loss of health insurance coverage. This is what the bill does. It slashes federal Medicaid spending by approximately that 1 trillion over the next decade. And it increases uncompensated care costs. So coverage losses will also compound uncompensated healthcare costs for hospitals and other healthcare providers in Virginia by hundreds of millions of dollars over the next decade. In Virginia, there are 7 rural hospitals that they were immediately at risk of closure before the passage of this bill. So these Medicaid cuts will accelerate this crisis, worsening the financial viability of these essential providers. So the work requirements, I mentioned this very briefly, but these requirements, they would require specified Medicaid enrollees to work, look for work, or conduct another qualifying activity as a condition for Medicaid enrollment. And this provision, it implements work requirements for able-bodied adults aged 19 to 64 without dependents, targeting the Medicaid expansion population. And Virginia is a Medicaid expansion state. So individuals must show at least 80 hours per month of work, community service, or participation in a work program, and also a monthly income equivalent to at least a minimum wage for 80 hours, or part-time enrollment in an educational program. The bill also limits exemption from work requirements for those with children in the home who are younger than 14 years old, rather than all parents, which will cause even more enrollees to lose coverage. This bill also requires states and Medicaid applicants to and enrollees to implement and comply with these work requirements by December 31st of next year. And states have already experimented with work requirements, and many have shown that eligible adults in need of healthcare insurance are often wrongly denied, or they just give up trying to prove their eligibility because it's too difficult. An example of this is Georgia. The Washington Post noted that in Georgia, just 12,000 of almost 250,000 newly eligible recipients received Medicaid after the state implemented work requirements. That was in part because people who worked had a tough time proving it to state officials, or their work didn't meet certain qualifications. So in addition to these work requirements, on the same date, December 31st of 2026, states would have to begin more frequent eligibility redeterminations. And states must renew eligibility for Medicaid enrollees whose eligibility is based on something called a modified adjusted gross income. So this includes children, pregnant individuals, parents, Medicaid expansion adults, and this will happen every 12 months. And states are also required to review eligibility within the 12-month period if they receive information about a change in a beneficiary's circumstances that may affect eligibility. So, additionally, the bill requires states to conduct eligibility redeterminations at least every 6 months for Medicaid expansion adults. So this is including Virginia, and it exempts more frequent eligibility checks for individuals who are Indian or urban Indian, Californian Indian, or who have otherwise been determined eligible as an Indian for the Indian Health Service. This change will likely result in more Medicaid and Medicaid expansion adults losing Medicaid coverage due to the frequent eligibility checks alongside these new work requirements. So those enrollees who would have previously had coverage for a full year may now only have 6 months of coverage if their eligibility status changes during the year. This change will also result in excessive paperwork for enrollees and state agencies, and this will likely result in eligible enrollees dropping off the program due to this level of paperwork. Additionally, state agencies, they're likely to make more mistakes when processing eligibility due to a doubling of their workload. And we've also been seeing a lot of states having to let go a lot of employees. So we're now seeing a decrease in the workforce of people that would have originally been doing this work. The bill, it also includes a new provision that allows states to establish 1915C, home and community-based service waivers, for people who do not need an institutional level of care. And for us at US Aging, we're happy to see this in the bill as it does help, it does have the potential to help expand home and community-based services for older adults and people with disabilities. However, because of the level of cuts to Medicaid in the state, we're not quite sure if states would actually have the opportunity to utilize this new provision. But our hopes is that states will be able to, but unfortunately, there's no way to tell until these provisions begin to be implemented. So the proposal, it also phases down the Medicaid provider tax. And what states use for this, so state Medicaid programs, they use these state provider taxes to help generate the state share of Medicaid expenditures. So the final bill, it restricts the state's ability to generate Medicaid funds from these taxes, which will then force a reduction in the state tax revenue used to administer Medicaid programs. And this will result in states needing to turn to general funds or other sources to finance Medicaid, or it could actually result in states shrinking their Medicaid programs to account for reduced revenues, which could lead to cuts to Medicaid home and community-based services for older adults and people with disabilities. So this lack of Medicaid funding, it could also have a negative impact on other general revenue funded programs should resources be shifted. And that impact could be seen in Older Americans Act programs, despite this bill not covering that. So the bill also, it reduces the maximum housing equity for Medicaid eligibility and reduces it to $1 million. Excuse me. And it requires states to impose, oh, one moment here. Okay, sorry about that. My computer decided to freeze for a second. But it removes the inflation adjustments going forward, and this is effective January 1st of 2028. It also prohibits for 10 years the implementation of a rule from President Biden's administration that made it easier to enroll in Medicare and the Medicare savings programs. It also adds data requirements on states to verify beneficiaries' addresses. Again, this is effective January 1st of 2027. So now to the question of the day. What about Medicare? So this bill, it reduces access to Medicare for temporarily protected or for temporary protected status and refugees who are currently eligible if they have paid sufficient Social Security and Medicare taxes. So before this bill, lawfully present non-citizens, they could qualify for Medicare by meeting work history requirements, or if they lacked the required work credits, they could meet the eligibility by meeting the length of residency requirements. So qualified non-citizens who worked and contributed payroll taxes for a required number of years, they were eligible to receive Medicare coverage on the same basis as US citizens. But now, and this is starting immediately, only the following groups can newly enroll in Medicare. And that is US citizens, lawful permanent residents, Cuban and Haitian entrants, and individuals from certain Pacific Island nations with special agreements with the US. So this eliminates Medicare eligibility for all other lawfully present immigrants, regardless of how long they have worked and paid into the system. And by July 2026, the Social Security Administration, they must identify current Medicare beneficiaries who do not meet the immigration criteria and notify them that their coverage will end in January of 2027. This represents a major policy shift. While undocumented immigrants have never been eligible for Medicare, lawfully present individuals who worked and paid into the system have historically been able to qualify for Medicare benefits. So I mentioned briefly earlier, the law imposes a 10-year ban on implementing improvements to Medicare savings programs, which help lower income Medicare beneficiaries pay for premiums and out-of-pocket costs. And the Congressional Budget Office estimates that this will save over 66 billion over 10 years. But these savings come from preventing eligible beneficiaries from accessing programs designed to make Medicare more affordable. And because this bill is projected to increase the federal deficit, it triggers something called the ESPAGO Act, which requires automatic and across the board spending cuts to offset the deficit increase. Medicare is also subject to these cuts and up to a maximum of 4%. The Congressional Budget Office, again, they estimate that these cuts could total approximately 535 billion between 2026 and 2034. These cuts, they primarily would impact provider reimbursements, which are payments made to doctors, hospitals, and health plans. And the cuts would be on top of other Medicare changes and come at a time when the Medicare Payment Advisory Commission recommended increasing payment rates for 2026. So, what does this mean? Reduced reimbursements could lead to healthcare providers, especially specialists and rural hospitals, opting out of Medicare, potentially reducing beneficiaries' access to care. And while ESPAGO cuts have been triggered before, Congress has historically acted to waive or delay their implementation. Whether or not Congress will intervene to prevent the current projected cuts remains to be seen. So there's a lot of things that are up in the air. We do not know a lot, but as I mentioned before, states are beginning to have these conversations in terms of what Medicaid is going to look like and also trying to prepare to better serve their residents. So, this is really more so recommendation for our members, area agencies on aging in terms of state involvement. However, if your state or your area is hosting things like town halls or just other community-based events where they're asking for input in terms of how you're or what you're experiencing, what you're observing as it relates to this bill, please do attend those. We really need as many people as possible to talk about the impacts of this bill and what they actually look like on the ground. So this is a way that you can be involved in the state and local level. And you can also feel free to reach out to your members of Congress. You don't need to be a policy professional or a lawyer to send an email or to connect with the district staff about issues and challenges that you're experiencing or seeing, in your community. So the Centers for Medicare and Medicaid Services and the U.S. Department of Agriculture, they're going to have to issue guidance or regulations to provide more detail in the coming months and years. And that also poses as another advocacy opportunity. And lastly, I'll end by saying, please keep informing your members of Congress about your concerns, any changes that you observe locally in access to services, or negative effects on older adults or people with disabilities. So our to-do list and our call to action here is really to protect and increase federal funding in FY 2026 appropriations, protect the Older Americans Act and other aging programs through education on the return on investment, and also weigh in on any reconciliation bill implementation and regulation opportunities. So again, you can find resources that can help you with this on our website at usaging.org/advocacy. Feel free to use those, share them with your colleagues, with your friends, with your family. We need as many people to be loud on this as possible. So don't feel afraid to reach out to your members of Congress on this. So here is our contact information, but I encourage you to check out our website. We have lots of resources available there that I think will be helpful in further understanding some of these really wonky policy provisions. So thank you again for having me here today, and I hope that this presentation was helpful.
All right. Do we have any additional questions?
I
The
just
one thing
wanted,
is I want to make sure that, see if both of you can provide your slides to us so that we can make them available to anybody that wants them after the fact.
is this being recorded?
Yes.
So the slide should be in the Zoom, right? Or
Yeah,
the
but
video.
it's
Yeah.
but that means people have to go through the video.
Okay, so you have two ways to get it.
Right. Does anybody else have any questions?
I guess more as a part of a conversation, what will it take to overturn some of these? I mean, a lot of this I understand starts in out years. So because it starts in out years, is there room for changing in those intervening years? Some of the big beautiful bill policies?
So that is it's a difficult question to answer.
Sorry.
No, it's okay. I wish I had the answers to this, but honestly, because this is a bill that is now at the federal level, where the impact can be to change, I guess, how it looks like in your state is going to be at the state level. Because what this bill looks like is going to be different across the states. Like California may have this impacts that are different from Massachusetts. So this is why I'm stressing to really be involved in any conversations that your state or your town or your city is having regarding Medicaid and SNAP or Medicare, because that's really going to be the way where you can make the most difference. But as of now, this bill is law, and unless somebody comes with a bill that can reverse all of this stuff, which is highly unlikely given that we have both a Republican House and Senate. This is the bill that we have to deal with, unfortunately.
Horrible.
Yeah.
Gary, did we cover all of the questions that were in the chat?
Yeah, I
That
think
were
so.
addressed to Michelle also?
Yeah,
Yes,
Michelle has
I've
been
been
typing
typing
in
away.
answers. So I think we've got them all covered.
Yes, I have been typing away, and I do want to make sure that I retrieve the resources that Liz put in here for the fairs and such. But we're here to help, and if you have any follow-up questions, you know how to reach us. This is a long game, and it's going to take a lot of advocacy, reaching out to your members of Congress, reaching out to your congressional officials, whether it be by phone, town halls, as Olivia shared, writing letters, emails, and things like that, so that they can hear the voice of the people in their respective jurisdictions um, to be able to make some change.
Okay. Well, it's anybody else? Otherwise, we'll close out this session. And thank Michelle and Olivia for a very enlightening, or as several people said, scary presentation. But in terms of Medicare, VICAP is also there to help you in terms of the kinds of issues that you might have with Medicare, especially with open enrollment coming up. So with that, we'll close this out. Next week, the topic is challenges of aging facing LGBT plus adults. And we have several guests, S.C. Neely and Roland Shepsky. So be sure and tune in next week at 10 o'clock. And meanwhile, enjoy this weather today because it's supposed to rain tomorrow. So, so
And
have a
Liz
good
has
week.
posted
Thank you.
a reminder to everybody that you have the option to save today's chat if you want to save the questions and answers. In the three dots at the top of the chat box, one of them is save the chat. So
There's some great links in the chat.
Right. Okay.
Thank you
So,
for having us.
All
Yep.
right.
Bye.
Good to meet you
Again.
all.
Have a
Yep.
good
Okay.
week.
Bye-bye.
Bye.
and I'll stay on for a few minutes for anybody that wants to save the chat.
Okay.